I just really loved the opportunity to make a difference. I think focusing on the social determinants of health, I want to work somewhere that focuses on trauma-informed care. I want to work somewhere that really addresses all of the things that go into a person's health, because the time that they spend at the doctor is such a small portion of their life. And then in fourth year, I was able to do a rotation at Katy Trail in Sedalia, and that was definitely kind of, I knew I wanted to work at a community health center, but after that rotation, I really knew. I knew that that was the exact kind of care that I wanted to be providing. Thank you for the nomination for this scholarship. I'm very honored to be a recipient, and I look forward to working at a community health center.
There's these little things that make a huge difference in each of these people's lives, and medical care is really just a small aspect of a person's life, but the entire part of their life can really affect their health. And so it's just, going into medicine has just showed me of needing to look at everybody's aspect, their whole aspect of their life, but then being a small part of it, just how big of a difference that can be. And it's just a real honor to be a part of these people's families. They're all about providing this quality medical care, regardless of whether you have the best insurance or no insurance. And that was just amazing to me. Thank you so much for nominating me for the Kit Bond Scholarship. It's been a huge honor and definitely warms my heart and encourages me to keep going in the path that I'm going of being able to serve our community.
A lot of our job here in the underserved is just education, right? So they may not get that normal dental education, and we're fighting against that, and we're trying to help people as much as we can to understand we don't have to take your teeth out. We can, start with prevention and give them a good jump start towards oral health, right? They're looking at the veneers, things like that, where our patients are just wanting that basic oral health, they just want to get their teeth fixed and not be in any pain. And so we get to see a lot of those people that otherwise would not have access to expensive dentistry. And it's been cool to see. Like I said, I get along with them, right? Because I grew up in a small town, Southwest Missouri in Ozark, and the people are just down to earth and super easy to get along with. They just want to be told the truth, and they want their mouth not to hurt. So that's been great. The people are super nice, and they're all, not all of them, but most of the people are very thankful for what we do here, which is nice. I just want to say thank you for getting nominated for the Kit Bond Health Scholarship.
It's important for people in Missouri to have good access to dental care, just like it's important really for everywhere else. This particular part of Missouri does have a significant population of low-income people, so something like a community health center obviously caters to those people, and it's something that they really need. The patients we serve in Neosho are fantastic. We have a really diverse patient population culturally, which is really exciting. You get a lot of different experiences and inputs from different types of people, lots of families, lots of kids. We even have patients who come to our clinic that could probably afford private practice, but they love to come there just because it's a great place. So Neosho's got a really wide range of patients. Thank you so much to everybody involved for this nomination for this scholarship. I'm incredibly grateful to be receiving this reward.
My parents are very giving individuals. Whenever they had a moment, I felt like they were doing something to kind of either give back to their larger friend group or their community, spend a lot of time doing charitable kind of things, and that underpins, I think, primary care as a whole, is the importance of community, the importance of sharing what you have with those that have less. And I've been reassured over the last year and 2 months or so that this is a place full of people who are extremely passionate, extremely dedicated to the work we do here. And I think that model just allows me to kind of keep that fire going, that passion going, but also provide really great care. and I've nothing but enjoyed it so far. Yeah. Well, thank you for the honor of being nominated for the Kit Bond Scholarship and for the honor of receiving it. I hope to continue to put the scholarship towards good use and serving the communities here in Warrenton, Missouri, and other areas throughout rural Missouri. Thank you.
I'm originally from Iran. I was raised in Iran. I have three. Yes, I have three sisters. I kind of had dentistry in my blood. I had few family members who were general dentists in my country, and I did my high school over there. Then I moved to United States in 2009. And my husband got accepted here for residency program, so I wanted to be in Missouri, but there are different schools in Missouri, but I picked just Missouri School of Dentistry and Oral Health because of the partnership it has with Affinia Healthcare, who serve underserved, it's a place for underserved population. And I really want to appreciate those who made a decision and selected me to be a winner of this award. It is really a great news.
So I would say that my interest in community health centers was definitely fostered through my dental school education. My dental school is definitely focused on serving vulnerable populations, and so I got a really good taste of that while in dental school because my dental school is associated with a community health center, and because I enjoyed my dental school experience so much within a community health center, for me, it seemed like the right step to starting my career. I just want to say thank you to the Missouri Primary Care Association for selecting me to receive the Kit Bond Scholarship, as well as selecting me to receive an initial scholarship through the state. The Missouri Primary Care Association has really helped me launch my career and has really helped support me in my career goals and working with the community health center, and I really just can't thank them enough for their support through all of this.
So I grew up here in Joplin, Missouri, and I've been a business owner here in Joplin since I left high school. That's given me the opportunity to meet lots of people in lots of different avenues and different venues, and to really get a grasp of what problems our community is facing. Once you can identify a problem, you really have one of two choices. You can do something about it, or you can not. And that's put me in a position that I am currently serving on 16 boards in our community. I spend the majority of my time in a volunteer fashion, and primarily to help the people that are unhoused in our community. We are constantly pushing to find new ways to serve the underserved, both through Access and the coalition that Access is part of. And anything that we can do to make the lives better for those people that are left outside, that's what we're gonna push for. I just want to take this opportunity to thank the people that nominated me for this award. It's truly the greatest honor I will probably ever receive in my life. Thank you.
Well, I wanted to be more involved in the community, and also I'm just a people person, and we just needed information in our areas about healthcare and so forth. To determine where the clinics would be located, we work with community leaders to serve the needs of the people in the various communities and in the 6 counties that we serve. As a board member, some of the accomplishments that I'm very proud of is that we have the 340B program that's helped to set up so that our patients get medicine at a reduced cost. We also went through a rebuilding process in 2014, and we have exceeded our expectations. I would like to say thank you to Chris for nominating me as a hometown hero, and thank you to Aaron for doing the narrative, sending it in, and thank you to Joe Purley and the Board of Directors of MPCA for the Hometown Hero Award. Thank you.
I became clinical director at Great Minds as I started as an RN in the Farmington office and then got promoted from there. As there wasn't any special circumstance, it just kind of happened and I moved my way up. Clinical director consists of me. I do policies, procedures, I take care of all the ordering, take care of the nurse practitioners, doctors, staffing, scheduling, infusions, injections, anything you can think of, basically clinic-wise, it's me. We did infusions, we did vaccine clinics, we did swabs. I could not tell you how many I did. Everyone did, actually. It wasn't just me, had the whole team. Couldn't have did it without them. We converted our dental trailer to an infusion center. So we do have 2 mobile units. One was used for just injections, one was used for just infusions. They were utilized a lot. We went to the schools, vaccinated teachers. We went to every school in the county, basically, we went to. Used them outside sources because we couldn't go in the building. So all weather, we were outside doing infusions and vaccines. Yeah, we had to figure it out as we went, and I think we did a really good job. I would like to thank administration, my colleagues at Great Minds Health Center for the nomination for the Hometown Hero Award. This could not be possible without them all. Thank you.
So I basically went to medical school in Pakistan. That's where I graduated from. I think oftentimes people ask me, why medicine, why family medicine, why did I choose to be a primary care provider? Well, the truth is that when I was done with medical school, I actually wanted to do OBGYN and ended up doing 2 years of OB-GYN. This was in Pakistan at the time, and at the time Pakistan was undergoing a refugee crisis, so I was also volunteering at refugee camps in the north of the country. That was really where my passion for family medicine came up. I suddenly realized that a woman was more than the sum of her reproductive organs, and she was someone who also experienced mental health disorders, chronic disease disorders, and that those things would probably impact her life to a far greater degree than anything else. And that was when I got really, really interested in family medicine, and what I like to call that bug for public health first started coming up, and recognizing that as important as the work that we do in a clinic is, it is equally important to kind of provide community-based services that just generally improve the health of individuals outside of what we ultimately can provide inside of the healthcare sector. I am honored to receive the Samuel Rogers Achievement Award and wanted to thank the Missouri Primary Care Association for the recognition.
First of all, it was called People's Clinic when I started in 1984. It was a small clinic located in a 2-story building. I think we had 3 windows maybe, less than 50 staff, and Peoples had just hired his first medical director. And he convinced me to leave the hospital ER and come and work with a visionary leader that was making a strong impact in this community. I was a little nervous at first, but I am so glad that I took that chance to be a part of something that is so great. I've taken care of over 3 generations of patients and worked with some amazing people and learned from a lot of people. I have had the luxury of working with some awesome staff over the years, because through all of my accomplishments, I couldn't have done any of this if I didn't have the staff that trusted me enough to follow and work with me. So I'm happy that they allowed me to be within their circle to take care of this community that I love so much and that I grew up in and came from. Well, Mr. B, I'd like to thank you so much. I don't call you Mr. Butler, I call you Mr. B, but I thank you so much for the nomination of this prestigious award. And MPCA, I've been with you the whole time, and I really am humbled to be awarded the Samuel U. Rogers Achievement Award for 2022. Thank you so much, everyone.
I've been involved in community health development for almost 4 decades. My work has been, over the years, really thinking about how to help communities build a full continuum of care. And I see the focus on population health, which is outside the health center walls into the community. Well, first of all, I was blown away when I was told that I am receiving this recognition. I am so thankful to the family itself, the Samuel Rogers family, the staff at Sam Rogers, who I've worked with over the years. Joe Purley. 23 years ago, he and I shared a belly laugh in Washington, D.C. that led to me becoming part, and I do mean a privileged part, of his vision and leadership for enhancing the community health center movement in the state of Missouri. Karen White, who nominated me, I just am so grateful that I can be part of a list of other prior award winners who have the great spirit of the community health center world. So for me, thank you very much for letting me be part of that.
I am very passionate about community health centers because they fill a critical need, not just in the St. Louis region, but all around the state of Missouri. There are many parts of St. Louis and many parts of rural Missouri that are considered healthcare deserts, meaning that folks don't have access to the basic care that we need. Community health centers are critical in filling that need and helping families and individuals have access to the care that they need to be able to be the most productive members of society. Back during the pandemic, I think it was very eye-opening for many of us. We realized for the first time as a society, in my opinion, in my lifetime, the importance of your neighbors being healthy as well. So, we were trying very hard as Missourians to keep the economy going, to make sure that, that we were still doing everything we needed to do to remain competitive. But nobody wanted to go to work with somebody who didn't have access to health care because that you didn't know if you could be safe or not. Nobody wanted to go to the dry cleaners or to a restaurant if you weren't sure that that person had access to health care. So community health centers fill a critical need in keeping Missouri's economy going as well, because we need people to be able to go to work, be healthy, and be productive. One of the public policy areas that all of us have in common is we care about people. Now we might come at it a little bit differently, but I truly believe that everybody that serves in the Missouri legislature is doing so because they truly care about people. So then my job as somebody who's in the minority party but still wants to work with people on both sides of the aisle is I have to figure out things that we have in common and things that we can work on together and figure out a pathway to make things happen. So it might be a little extra work, but it's totally worth it, and it's the right thing to do for the state.
And when I think about just community health centers, how they fill in the gaps, how they show up for so many families, and I know that firsthand. I think very clearly, now serving in the state senate, many families that I serve and represent that really count on community health centers to provide that access and really fill in so many important gaps when it comes to quality health care. Yeah, and that reminds me, things like behavioral health. I'm very, very proud as a board member for People's Health Center to be able to advocate for the first children's health center for behavioral health in the St. Louis region, the first in the city of St. Louis. And what that would do is provide not only behavioral health services for children, but address the social determinants that impact so many young people in communities that I serve and represent, and throughout communities in the state of Missouri. And to be able to address stigmas. I mean, when you think about it, people of color, in particular men, have a very difficult time talking about mental health issues. And to be able to be a champion for that and not only address the importance of removing the stigma, but also ensuring that folks have access to quality health care and also mental health services has been extremely important.
Hi, I'm Governor Mike Parson. Thank you for inviting me to join you for the Missouri Primary Care Association's annual conference. On the behalf of all Missourians, I want to extend a sincere thanks for the work each of you have done to ensure Missourians' health, especially over the past few years. Community health centers are an important part of our state's healthcare system. The services you provide are vital, not only to 600,000 Missourians who use a community health center as their medical home, but to the entire state. Over the last 3 years, you have been tasked with more than providing routine care for your patients. You've also been on the front lines of a global pandemic. You came to the table with solutions and the ability to act quickly. You organized and staffed massive testing events. You distributed at-home test kits and N95 masks. You gave thousands of vaccines at primary care visits, pop-up events, mobile units, school collaboration, and homeless shelters. You were there for our communities, and you saved lives. As you gather this week to plan for the future, I hope you will also take time to reflect on what you have overcome in these past years and how much you are capable of. Thank you again for all the work you do and for your dedication to the people of Missouri. It is an honor and privilege to be the 57th governor of the great state of Missouri. God bless.